In the 3 decades since polio was considered eliminated in the Western Hemisphere, vaccination coverage in South America has been dwindling. Now, less than 80% of the population on that continent is protected from polio, according to data presented during this week's press briefing from the Pan American Health Organization. In some countries, the problem is more acute. PAHO Director Dr. Carissa Etienne said that 12 nations in the region were at high or extremely high risk of a polio outbreak. To emphasize the gravity of the threat, Etienne alluded to the unvaccinated New York man who was disabled by a polio infection in June, following which the polio virus was discovered in NYC wastewater samples.
It's been nearly 30 years since the Americas became the first global region to wipe out wild polio, thanks to the comprehensive and coordinated vaccination campaigns. But dwindling vaccination rates worsened by the COVID-19 pandemic have left many of our populations unprotected. Let's be very clear. Polio is not a treatable disease. Prevention is the only option, and prevention is only possible with vaccines. As we saw in New York State, poliovirus can appear and spread quickly and quietly in communities with insufficient vaccine coverage. PAHO is in close contact with the United States, and we have issued several alerts to member states so that they remain vigilant. I really cannot state this strongly enough. We urge all countries in the region to strengthen surveillance and proactively reach the unvaccinated with polio vaccine.
Monkeypox, which unlike polio has already been detected in South America and the Caribbean, has declined overall in transmission in the past 2 weeks. However, Dr. Etienne noted that some countries were still hotspots and recording rising case numbers.
Member states must update their national dashboards regularly or share this information with PAHO so that we can target our efforts where they are most needed. In the last few weeks, we have seen countries relaxing on vaccination data reporting. And this brings to mind my third point, public health measures. Member states must act wisely and continue to promote these practices in places where many remain unvaccinated or where cases are climbing.
When it comes to the third viral concern, COVID-19, the PAHO director highlighted a number of Caribbean islands which, quote, continue to lag behind in vaccination coverage. Despite United States President Joe Biden's recent declaration that the pandemic was over, the head of the region's premier public health agency stated that COVID-19 was not going away anytime soon.
The risks are significant if we simply let the virus continue to spread freely. Active transmission can lead to new variants, and we should learn from the past and remain prepared to respond to new surges. Even if most COVID-19 cases are mild, this disease can have long-term consequences for patients and for our health systems. If we remain committed, we can keep COVID-19 under control.
Etienne urged jurisdictions to continue tracking and monitoring cases as well as progress with immunization. Next week, the PAHO director will join ministers of health from across the region as they meet for the 30th Pan American Sanitary Conference. The event is expected to bring together the health leadership of the region, according to Etienne, to, quote, work together to improve health for all.